Nice. Went right to the stick.
The thing probably that I'm most passionate about is just working with the kids and the families. I love working with kids.
Let's go see the waterfalls, huh?
My dad's a psychiatrist. My mom's a psychologist. You know, the mental health business, if you will, had run in the family.
See the rim, right? See the rim.
Probably the biggest thing is helping families know how to parent their children well.
With kids, I think being an advocate for them and helping them to put into words what the difficulty is a big piece of why I enjoy doing it, because they can't do it for themselves.
Children's Mental Health Today. With St. Luke's, there is hope.
There's a lot of stigma with children's mental illness. In fact, here in Idaho, I don't even know if we're comfortable calling it mental illness. We call it like behavioral health.
Kids are incredibly resilient, but we have to be able to recognize sometimes kids need someone to talk to also to kind of figure things out.
We have to address the whole child, their mental needs, physical health. If we don't have a multidisciplinary team, we can't address the whole child.
Our vision to help improve patient access was to look at our ability to integrate with some mental health with primary care services. What can we do to where we're working together and really kind of seeing this more as an integrative solution? I've always wondered what your vision for children's mental health for the state of Idaho was as a family practice physician.
We just haven't had access to mental health professionals to be integrated with us, so the idea of being able to do that, I think, is just revolutionary and will just so much improve that kind of access to care.
And that's one of the nice things I like about co-management with primary care, that we're able to work directly with them and get kids back to as close as possible to their regular lives, and doctors will get kids better and we'll keep them better.
I do this sort of intervention with parents where we teach them to be the therapist a little bit in the session.
We're just finishing up with a little kiddos group. We have 2 more weeks for 5- and 6-year-olds.
Evaluations with kids are just a whole different world, because in some ways it's like investigative work. You have to pick up so many different pieces of information and sift through everything and put it all together to find out what's happening. And with kids, again, to see that change in them, to see that kind of light come on, like, oh my gosh, you really get me, or oh my gosh, this is really going to help me, and you see that change, that's when I realize this is what I got to do.
I've never met someone that doesn't get better. It's almost magical to see kids get better over time.
We feel like, you know, we're here to help them, but a lot of times as individuals in the helping profession, we get helped. You know, we get inspired, we get encouraged. So it goes both ways.
How do you guys leave the session kind of giving parents and our children a sense of hope?
Without hope, change can't happen.
I think a big part of what we're trying to do here is really try to instill a sense of hope, to really help to educate parents, educate our colleagues, educate our community. This is an investment. It's an investment in our children's future.
Well, I think what we do is help people find the hope they lost. I think that's probably one of the most important things that we do on a daily basis.
For more information about mental and behavioral health services at St. Luke's, go to stlukesonline.org.